All right, trying to be prompt. Welcome to the May 8th. Hard to believe it's May 8th, but May 8th Gravity Terminology Call. This is the enhancement cycle of our terminology workstream. We are in end-to-end review of our Coding for Food work and in our program classification work as well. And we are excited to be here. So next slide. And as I mentioned, I'm going to say it one more time, a significant portion of our Food is Medicine friends are all in DC at a conference that I just left early in order to be at this meeting. So our attendance might be a little slim, but it's because we all spent 2 days talking about this amazing work. So it's good to be here representing. Thanks for joining. We mute folks upon entry. All calls are recorded. Please, we encourage conversation. Again, this is end-to-end review, so there is a formal process of comment, but we really want to make sure we're talking, and there's a few different topics to talk about. Just make sure that you send your chats to everybody so that we can all participate in the conversation. Next slide. We are, as a standards developing entity, responsible for abiding by antitrust practices. Anyone participating on the call, including ourselves, has responsibility to comply, and we apply the following antitrust practices pretty liberally. This includes any direct violation or anything that might be construed as an antitrust violation. So this is just part of the work of being a standards initiative, and we appreciate that everyone follows by this, and we state this every single time. Next slide. Well, so our agenda is welcome, and then brief little highlight of Gravity. We have an update on our vision, which is exciting. Going through status of end-to-end review on our Coding for Food Phase II initiatives, and I have a brief update that I didn't put a slide on our Phase I initiatives. We're then going to go into some relevant areas of enhancement. Again, this is our enhancement meeting. We do new domain work, addressing new domains with our technical expert panels and all the formality of that in the alternating meeting. But anything that's an enhancement to our current resources, we're trying to center here. So relevant to that is an update regarding needing to enhance the LOINC document value set. We'll talk more about what that is in a few minutes. And then we'll close out with next steps regarding our program classification and program enrollment or program documentation. And again, the key part of end-to-end review is getting formal comments in prior, significantly enough prior to the vote on the 29th so that we can integrate them if we need to. Next slide. Next slide. I already mentioned the 2 terminology calls. So I'm going to go into the technical work stream. The next topic on the technical work stream next Wednesday is the social care capacity use case. As we were just talking as a program management office technical director, Corinne, the program manager, myself, about how many of the use cases we develop in Gravity are not just relevant to social care. And so we're talking about CBO capacity CBO ability to represent capacity to guide and intelligently guide referrals to entities that can accept referrals in that meeting on Wednesday. And what I was mentioning just anecdotally, and this is probably well known to many of you, that as a rural healthcare provider, there is a lot of capacity issues beyond just in the social care space. So looking forward to having that use case and the resources we develop there really solve and represent solutions for all areas of care, including healthcare. Capacity is a really critical functionality that we'll be exploring as part of our update this year in the technical work stream. So come to the meeting, participate. It'll be led by my amazing colleagues, Corinne Bogan and Corey Smith, the technical director. And then we're very close now to our quarterly implementation affinity meeting. The next one is about closed loop referral standards and how they address patient and provider burden. We really are trying to focus not just on implementation, but on outcomes, and specifically outcomes related to return on investment. So how is this helping, right? Either monetarily or in improved health outcomes, improved social care outcomes, or improved perception and burden on the behalf of the provider and patient. So that's our focus for 2025. So join us on May 29th, and we look forward to seeing you there. Next slide. Any questions on that? Okay, next slide. I was telling you, Sarah, I literally just got off the interstate, so it's a whirlwind. So the Gravity Project vision, brand new, revised with our amazing members. We aim to be a representative and sustainable consensus community that's collectively driving social care data standards to support the goals of population health and health equity. our members to revise and look at our vision, mission, and goals every 2 years, and they just completed that process, and so it's my honor to bring it to you all today. Again, huge thanks to the members. I think that's the next slide. Next slide. When you think about, so the people that are the membership are our amazing members that give us financial support for the work. Incredibly grateful for all of them. We wouldn't be able to do it without them. And then, of course, our designated memberships that we include in order to ensure from a social justice framework. We have community-based organizations participating in governance and patients participating in governance. So all of those entities combined to revise and review our strategic vision, mission, and goals and objectives for 2025 and beyond. And we're incredibly grateful for them. So thank you, thank you, thank you. And again, the strategic goals are part of our steering committee, which is the advisory committee, and then we just are incredibly grateful. Next slide. 2025 roadmap has been settled for some time. So again, in the gravity terminology, aiming toward addressing food access, neighborhood safety, and access to green space in the fall. We're already securing subject matter experts to help us in that work, and it's pretty exciting. We're doing the enhancement works right now. As you're aware, that's the light green window. And then the technical work stream is always updating. But the 3.0 update is what we were talking about, and really the focus of the technical work stream calls every other week. So please do come and participate in that. There's lots of really important, significant resources that we're enhancing the IG with over the course of this year, and we hope you come. And then I already mentioned the implementation affinity group. So really the focus of 2025 from this point onward is finishing the work we're doing now in enhancements and the spring domains, aiming towards the fall domains, and then ensuring everybody comes and joins in the work of the technical use case development on Wednesdays. Next slide. We would not be Gravity if we didn't mention and abide by and center always our data use principles for equitable health and social care. They are ensuring personal health outcomes, ensuring population health equity, ensuring personal control, designing appropriate solutions, ensuring accountability, and ever so importantly, preventing, reducing, and remediating harm. We abide by them in design. We consider them when we're developing terminology and technical resources. We consider them in implementation. It's part of, it's woven through everything that we do. Next slide. And then this is a version of our, 4 core activities that are expanding all the time, right? So these 4 core activities are certainly expanded when we think about the work of the resources and use cases in the upcoming IG. And certainly when we think about some of the outcomes evaluation that we're focused on in 2025 and beyond. So this is why this gets blown up a little bit. So on the left-hand side is the work of interventions of the enhancement meeting, kind of, right? So we're focusing on interventions, billable and reimbursable HCPCS terminology, enhancements to some of our, document concepts. All of this, again, is expanding these 4 core use cases and ensuring we're really representing the wholeness of how we care for humans in health and social care situations. Next slide. I'm glad you like it. We're trying the model of Gravity has outgrown its original 4 activities. So we're thinking about how to represent it, but it's really, there's just so many more use cases than we had in the beginning because there's so many more ways that we care, right? Here we are, May 8th. We have this meeting and then another meeting and then the vote, right? And regarding Coding for Food, we're doing really well. It's in that we've had pretty stable concepts for the last, month or so, but here's where we are. So we're in this formal end-to-end review process. And we look forward to having the public vote on the 29th. We're pretty well positioned. Next slide. So critically for end-to-end review, and this is what we ask the community to do, this is what the subject matter experts are doing, and this is what the terminology team is doing constantly. As we're looking at what we have and we're asking, are things missing? And you'll see some missings reflected in our updates today in the Coding for Food terms, things that we thought needed to be put in there. Are there things that are incorrect and need to be changed? Are there concepts that are unnecessary and should be removed? Right, and we did that in end-to-end review and subject matter expert work as well. We kind of we added things, and then we're like, actually, that's not core and necessary, so we pulled it back. right? So in end-to-end review, really respecting the labor that we've all done together up until this point, many months. Comments and evidence for changes need to be offered in written form with a rationale and evidence for suggested alternate approaches, right? So respecting where we are, respecting all of the labor that we took to get here. If something needs to be changed, we want to document it formally. So send an email to gravityproject@hl7.org, and then with the rationale and evidence, and then we'll bring it to our subject matter experts and we'll work through it. And all comments have a formal response. There's just either acknowledge no action because no action is required, or some kind of response and action to change things. Any questions on end-to-end review? Supplies both to new domains and to enhancements work. Okay, next slide. Next slide. Coding for Food Phase II. Next slide. So I'm gonna put some information in here that I did not make a slide for, but that's fine. So we have been doing 2 phases of work. We're about to complete the second phase of work in Coding for Food. Phase 1 was addressing topics of medically tailored meals, produce prescription, medically tailored groceries, and healthy groceries. We just got heard back from CMS that they have reviewed our phase 1 submissions, but do not have the bandwidth at this time due to staffing shortages to review it at the next meeting. So that means we got it. We acknowledge it, and so likely those concepts will be heard at the November meeting, and there'll be more to come. But that's a good sign. It's not that anything needed to be changed per se, and there might be changes in the middle between the November session, but we did hear back and we were awaiting that. So that's good to know. Another thing that's coming out of the phase 1 work is a kind of a review of what it's going to take to enable some of these medically tailored concepts. More to come on that, but as you may remember, in each of those work groups in the initial phase 1, the American Academy of Nutrition and Dietetics and registered nutritionists and dietitians were woven throughout every single group. And there's a lot of opportunities to support RDNs in the work of food as medicine concepts. So there's some observations coming out there as well. So regarding phase 1, we have an update not being heard at this next meeting, so likely in the fall. And then also look forward to having, some kind of opportunity to reflect on how to appropriately compensate RDNs for their labor, which is involved in the medically tailored meals and medically tailored grocery concepts. And then here we are at phase 2, and our phase 2 charter was to address cooking and kitchen supplies and the concept of cooking education, teaching kitchens and food pharmacy. And that's what we're doing end-to-end review on now as well. Again, all of Coding for Food concepts and work is available in the food insecurity section of the Confluence. Next slide. I hope that any questions on what I just said? Just making sure. I hope I'm being clear. I'm a little road weary, but I think I'm making sense. I just want to sit here for a moment. I just mentioned the role of the expertise in the Coding for Food world, and I always mention this a little bit, but having just come back from the Medicaid Food Security Network Summit, so many of these brilliant folk were there. And the amazing thing about Coding for Food is it literally is the outgrowth of like 6 years of effort of trying to figure out how to have a plan and consensus plan for developing HCPC concepts for core food as medicine initiatives. And this amazing, robust advisory behind the subject matter experts and wrapping around them with support is a huge example of how representative the Coding for Food work is of the expertise in the food as medicine ecosystem. So incredibly grateful for all these advisory committee members who have been volunteering their time really for like 1.5 years. So not only when we were doing the initiatives, but to help craft it, to help make a plan, to help consider how to select subject matter experts. Again, incredibly wise and wonderful folks that I just got to see a lot of. So very, very grateful for all their effort over the course of the last couple of years. Next slide. Specifically with Coding for Food, as I mentioned, the Coding for Food Advisory Committee and our friends at Fullwell and Gravity, we crafted a plan for selecting subject matter experts, just as we do with new domains. So our experts for cooking and kitchen supplies and cooking education. These are the amazing folk who've been helping us, meeting every other week, really just bringing all of the evidence to bear. And so the great amazing thing about these groups is they represent not just, the science and the research and the literature, but also direct provision. In every single one of our subject matter expert groups, there's direct providers of each of the services so that we can make sure the concepts we build meet their needs. And we've also had, and I forgot to mention this, I think prior, a patient advisory group as well behind the scenes to ensure that the concepts that we're representing include the wisdom and expertise of the people who are the most able to represent the importance of the concepts, which are the people who receive services. So the subject matter experts connected us to patients, and we had private sessions with them. And again, thanks so much to all of them and the folks at Fullwell who were doing that work to make sure that what we developed was fit. Next slide. So going forward, there's going to be some changes. Again, we are an end-to-end review, so you're going to see changes reflected in things that are struck through or changes reflected in things that are bold. There's a couple different ways that we're representing that. And so just going to explain only things that are changing and not things that are constant, given we're an end-to-end review. So we've settled on a name for the whole thing, really, which is, so we're talking about general like kitchen supplies. And within kitchen supplies, there's appliances and kitchen tools, right? So there's a lot of like, even the name of the thing is to be determined. So kitchen tools is where we settled, not kitchenware. So this is where I struck it out because you'll see we use the word tools repeatedly in our definition. And we have, as we mentioned before, we have a large appliance and a small appliance concept. Next slide. So within kitchen tools, we have the base simple concept, which is core basic kitchen tools to prepare, consume, and store meals. And we had a reflection regarding the use of our adaptive statement. In the past, the opportunity to adapt instruments, tools to different needs based on occupational assessments and OT was only on the utensils. But we had a deep think about how adaptation applies to pretty much almost all of the tools, including knives, including serving utensils and tongs. And so we realized actually that adaptation was part of that assessment. And so we brought it up to the highest level. So instead of using adaptive if required, and you'll see that on the next slide, only in the utensils, we now included it in the actual assessment to make sure it can be carried through each of those different concepts. We also had a huge concept discussion on quality. This was really brought forward by the patients, the patient experts who were interviewed for this, because part of what was so moving was the value and quality of what they got was greater than they expected. So to a point, the individuals receiving the kitchen tools in implementations across Massachusetts and like other states, they noted how honored they were and proud they were to get high quality tools. I'm not going to mention name brands, but there were lots of brands of like tools and appliances that they got. And although we didn't want to specify a generic quality concept because quality is in the eye of the beholder, we did want to be clear that we were not talking about things that had been used, right? So for the individuals who are receiving this service, they're getting brand new things, right? Bought for them or from fresh new stock on the shelves of the provider. And so that seemed pretty important. So a second update is not previously used, which we thought was the best way to say new, clearly. Some of the implementers noted that they do have some secondhand things that people can get for free, but they're never included in the provision and never billed for to the payer. In every implementation, the person receiving the services gets brand new things. So that's the end-to-end review, looking at what's not there, right? We noted that we needed to add not previously used. And then we also noted that we needed to apply adaptation to all of the tools because adaptation applies to all of them. Any questions on those updates? I might be missing comments. I hope I'm not. No, I'm not. Sarah B is just doing amazing links. Okay. These are pretty stable concepts for end-to-end review, so I hope it feels steady. Next slide. So the only update in the actual details is that we crossed out the adaptive if required on tableware, because as I mentioned, it really applies to everything. It applies to cooking utensils. It applies to knives. It applies to cooking and serving equipment. So we didn't want to limit it just to the tableware. So you'll see that now that it's part of the meta concept. And that's the only other change. Last time, if you were here, not here 2 weeks ago, we added the culturally appropriate assessment as part of the assessment. And we also added an asterisk for other additional tools if appropriate after assessment, because there might be cultural modifications. And all of this is normal best practice in the implementations that we see across the country. Any questions on this? All right, next slide. On to large appliances, the only change here is not previously used. We did a quick assessment to see whether we needed to add the adaptive, but although they're ADA accessible refrigerators and freezers, we didn't, all of the OT friends I asked thought that wasn't necessary. So not previously used is the only significant change here. And this has been studied again for, I think, about 3 to 4 weeks. Next slide. And then in the small appliance, so Sandra, thank you. If we go back a couple slides, we did review, we didn't take things off if in some individuals' assessment, and these are all exemplary, it's not a have to give, right?
Yeah.
So, but we couldn't take things off if in some individual preferences, it was thought to be something that was essential. So, but we did try to be clear, as we mentioned with you. Maybe what we could do is maybe not take plastic wrap off, but just simplify it to be wraps.
Well,
Because
that would be great. I mean, you don't have like wax paper, things like
exactly,
that are
exactly,
other really appropriate and
exactly.
useful, or these beeswax kind of.
Exactly. Yeah, the wax linens, that's what we use
Yeah,
in the house all the time. So
yeah.
you wouldn't mind, because it's end-to-end review, just sending an email about that
I'm
concept.
happy to.
Love
Yep,
it.
yep,
Awesome.
yep,
Thank
yep.
you. Thank
Thank
you.
you.
Awesome, and thanks. That's an easy revision. It's the same one we did with Tupperware, right? Taking out the default thought to plastic and allowing for other options. Thank you so much. Any other questions? Awesome. Okay, great. Next slide. Oh, and then, so this is the small appliances, which was where we were. The only adaptation is the same one that we had with the kitchen tools, is that small appliances are often adapted to meet the needs of individual users and with modifications. And so we wanted to include that as well. So just noting that if an individual required modifications and adaptations, that we could do that. Otherwise, no changes. And then this base concept is small kitchen appliances, and nothing has changed there. Any questions? All right, next slide. So this is the section for cooking education, teaching kitchen, and food pharmacy. We really have centered on cooking education being the generic concept, because both teaching kitchens and food pharmacies are versions of it. And so you'll see that over the course of the next slides. And we really are centering in on the concept that covers concepts regarding cooking skills, because cooking skills are an essential component, and only nutrition classes are not included in this concept. So only nutrition is included in existing nutrition concepts elsewhere. And we're really trying to fill the gap of the cooking skills. I hope that makes sense. And the food, if you're getting food at any of these, at the cooking skills class, then that's represented in phase 1 concepts. Next slide. So there's only two additions. We had a lot of thought. There's some things we put on here and then we took away. There is only one, there's only one concept that's going to have 2 versions, and I can explain that more in a second. I'm sorry. We're not making a concept for nutrition only, because that's represented in the other nutrition counseling HCFIC code that exists and the current MNT concepts. And it's also represented partially in the diabetes education concepts. And so we are not building an additional nutrition concept only at this time. the cooking education concept does contain cooking and nutrition education, and there are going to be two versions of it, one for group and one for individual. But is not going to be an additional nutrition concept beyond nutrition counseling not otherwise specified and the MNT codes. Denise, does that make sense? I hope so. And MNT is medical nutrition therapy, which is the core practice of registered nutritionists and dietitians and other nutrition professionals. Great. Perfect. Wonderful. So the only changes is we were reflecting on what on the basic nutrition concepts and realized that portions and serving size were really crucial components of basic nutrition concepts that were not contained in the what, which is really like what you need to eat as opposed to how much of it. So we still have what people should eat more of, less of, and why. And then portion and serving size was brought out to be a second basic nutrition concept. Adaptations for cultural preferences, and the may include diet-related condition prevention and management is unchanged. In skills development, we wanted to lean a little bit more deeply into what it means to teach about concepts of food procurement and storage, because many cooking education instances teach about how to buy foods based on analyzing cost per unit and how to maximize your dollar. Right? Looking at the stickers, figuring out which is the more or less expensive bean, choosing the one that's less expensive, looking at it. So that was a critical part of the food procurement and storage that they felt like needed to be added. Other than that, there's no additional changes. I want to note that part of what we've been doing over the last couple weeks and the last month is really looking into precedent, following very carefully the diabetes education, HCPCS and CPT concepts that are modeled very, very similar to this, and just ensuring that we're setting the submission and implementation up for success. We wanted to note that and I don't have it represented here, but I should have, and my apologies, is that the diabetes education, both group and individual code, is billed by units, because part of what we were thinking about is the complexity of all of these different possible components and how do you have parity across the different instances. And so what we are going to be doing with our submission is following the diabetes education precedent and have the HCPCS concept represent 30-minute units. And then as with the diabetes education, CPT and HCPCS, what you're going to do is like figure out how much time you spent. And then with diabetes education, there's an attestation section where the person submitting the code lists the different components that they addressed. And just like cooking education and diabetes education codes, there's a list of things you can cover. And so we have this list of things. And so the submitter will say, 2 30-minute units of cooking education covered general nutrition concepts, portions and serving size, food procurement and storage, understanding tools, right? So they'll attest with those core common components. Does that make sense? Again, following precedent, just the way the diabetes education classes are built, so it should be easy. It's always good to do things as people do them in other places. Sound good? Okay, great. Great, we're getting there. Next slide. Oh, here we are at the end of the Coding for Food questions. So pretty stable in end-to-end review. So Sandra's going to submit the one concept, which again, we're trying to build space, Sandra, so thank you for catching that. Not to default to plastic options, but allowing them if required. So the plastic wrap needs to be changed to allow other wraps. So thank you. Any other thoughts in end-to-end review? It's pretty good, friends, knowing that all my friends in DC are listening to Rishi talk right now. So they're not here, but we're doing them proud. So thank you so much. Okay, now for those of you who are just here for the Coding for Food stuff, we're transitioning into another section of our work. It's about to get super nerdy. So not that food is medicine is not nerdy, but it's about to get technical. So we're gonna go to the next slide now, and we're gonna talk about some updates that we have to do to the LOINC document value set and the LOINC document ontology to represent social care concepts. Again, this is regarding enhancements. This is not just new domain work, it's thinking about what we have and analyzing it for completeness and helpfulness. And this is definitely an area of that work. Next slide. Bye, Sandra. All right, so to align with US Core, and again, I just literally edited this slide this morning on the train. So Monique's on I think Monique's on the call, so maybe I can have her help me if I got anything wrong. But to align with US Core, Gravity has to reference, and that was our whole last update for our implementation guide, right? Was aligning with US Core. That's what we did. SDU 2.3. That's what it was about. So to align with US Core, Gravity Project had to reference the LOINC document types in the observation profile. It sounds like a technical meeting, but I promise we'll get there because we're concept makers over here in terminology. We asked for a variance because when we assessed the list of possible LOINC document types in this resource, there were not sufficient social care documents. But this is what happens when you say there's not sufficient social care documents. Then HL7 says, make them. You make social care things, make social care documents, then the value set will have the codes you need, right? So we're like, oh, that's okay, we can do that. But the problem is that it's a little bit more tricky than just making a social care document because every document within the LOINC document types and LOINC document codes, thank you, Sarah B., follow a logic model called the LOINC document ontology. The LOINC document, and this is like, and it sounds super nerdy, but it's going to be fun, I promise. The LOINC document ontology is a special set of LOINC codes that are built on a framework for naming and classifying. And this is why it's terminology, because this is what we do, right? We name things and classify them. And they're all based on key attributes of documents. And the attributes provide consistent semantic documents exchanged between systems for many uses, right? And if you look at the LOINC document ontology, and I'm gonna, Sarah B, if you want to, I know it might be tricky, but maybe we should go there. We have time because I'd love to show you what is there. So if we go down to the search, if you go down to the, there we go. You can see how there's these sections, right? There's values in the ontology. There's values of the subject matter. There's values of the role. There's values of the setting. There's values of the type of service. And there's values of the kind of document, right? So get our concept hat on. If we look at the LOINC document value set, if we think about the LOINC document ontology, Gravity looks at it and says, do we have the subject matter domains we need? Do we have the roles we need? Do we have the settings we need? Do we have the types of service we need? And do we have the kinds of document we need? Does that part make sense? Because it's what's missing is within these axes. I see us. Okay, great. So now if we go back to the slides, and you all have the link, you can play around with the ontology, super fun. Next slide. So when Gravity analyzes this at the most fundamental level, there's some really key gaps that and we're going to submit them to LOINC. LOINC is aware. They're all ready for this because LOINC, our partners at Registry, were lockstep with a multi-year partnership. When we look at the ontology, we see some missing things. We see absent domain, social care, right? So if we have a social care domain and we're going to submit for that, we can create a social care kind of document, like social care note, right? But we can't create that until we create the social care domain. Does that part make sense? Roughly? Okay. Same thing with roles. There's a social worker role, there's a nurse role, there's a patient role, there's like all different kinds of specialties, but there's no community health worker, right? So I can't make a community health worker note because there's no community health worker concept. So we have to submit for community health worker, right? And then we think about setting, right? There's no community-based organization setting. So we have hospitals, outpatient, emergency department, patient home, but there's no community-based organization setting, right? So in our first early view, we're submitting just these 3 things, and at least we'll be able to make a social care note, right? Which, or social care document types. And so that is fantastic, right? At the highest level, we can create a general document that can be a type that can be applied to different types of documents in the observation profile. But we also want to just open it up. This is going to make us be in compliance, right? So we can align with US Core, but this is going to be an ongoing process that I imagine we'll revisit over and over again in the enhancement cycle. And so we just want to be transparent about it, right? So this is what we're doing now. We're totally open to advocating and submitting for other concepts if they're felt to be needed. The ontology is the best way for assessing if the concept that is desired and needed is present. And we're going to be filling these gaps, but there are likely many more. I just want to note that in that massive, in that little call out, I want to recognize that Monique, hi.
Yeah, no, I'll let you finish. I'm just waiting till, yeah.
Yeah. So I want to recognize that many of the partners we have in care provision are not what is classically, like they wouldn't name themselves as a community-based organization, like a WIC office is a government office. It's not they don't typically call themselves a CBO or the SNAP office or the housing agency, right? So we'll be doing a little bit of recon to make sure that the fundamental legislatively supported entities are represented, because the people working at those entities are non-clinical and they're not community health workers, and the setting might not be a community-based organization. So Monique, yeah, and then get to.
Yeah, so back to the beginning, when you started down this document trend, just to set
Great.
sort of the framework a little bit again. So in our implementation guide, we create observations, like an observation screening response. And that can be derived from a questionnaire, or it can be derived from something called a document. It may be coming in some kind of a document. And we don't have to reference that document, but if we want to reference it, it has to follow certain rules, like the type of document, as Sarah said, has to come from LOINC. And then to do that, we have to name that thing, get that thing into LOINC, and do all these other steps. So while it's not required that we use a document to create an observation, it's an option we have to reference as the observation came off of that document. And currently we're limited because of this issue that Sarah's just described, the constraints on creating that in FHIR.
Amazing. Always great. Thank you, Monique. And then Marianne, I tried to answer your question too, right? I think I did. I think I tried, and I hope I did a good job. But I hope, so again, so that's a really good question, Payal. Welcome. Nice to meet you. And licensing is not, this is not a billing related concept. This is a meaning related concept. License, as far as I can tell, the roles is just the role without any kind of certification on there in this framework. And licensing for reimbursement is represented in other models in other places.
That makes sense. Thank you.
Oh yeah, you're welcome. And again, you can explore the ontology, and it's easy to, like, I know who wants to explore an ontology on their free time. But you can see that played out. Like, for instance, social worker is the most clear one. There's only one social worker. Well, it's not an LICSW, which is different than social worker, right? And so just want to, like, that's part of the trends that I saw there. And there's not even very many different subtypes of nursing, right? And there's all different types of nurses. So I just want to say, in my original assessment, I saw no capacity to differentiate types of levels of certification that relate to compensation. Any other questions? Again, so this is our first take. Critical absence, the domain is the biggest one, right? And then the rural community health worker. Hi, Corey. I didn't know you were here. Hello.
Hi.
Hi, friend.
Yeah, maybe this is for those who are interested from the FHIR specifics of things. The why. Monique covered most of it. I just wanted to add one more thing as to the why we're needing this. Is that in our most recent update to our implementation guide, which is 2.3, which is being published here very soon, within days. What the purpose of that update was to align with US Core 6.1 and 7.0. And in US Core 6.1 and beyond, observation requires you to use a US Core document reference. So there is a US Core profile for document reference. And in that US Core document reference profile, there is a requirement to specify the LOINC type, to use a LOINC code to specify the document type. So it's really, long story short, our alignment with the more recent versions of US Core is really what made us have to look at this more closely.
Okay.
Thank you.
And you have to forgive me, I haven't seen my friend Corey in a little bit because I've been away. So I was like, I didn't realize he was here. So Corey got my enthusiastic Sarah greeting. Any other questions? And again, I do want to, Marianne, you and I, hi Denise, go for it.
Had to unmute. So am I understanding that sometimes if you don't name the document, it's not required? I'm just thinking of what Corey and
No,
said. So if that's true,
I think just to be clear, Denise, there's an optional opportunity to use a document.
right?
If you do use it, it has to have been able to be named or have a type named, and
Yeah.
that type has to come from LOINC.
Okay, so it's like my IRS forms. If you put the document in, you got to explain yourself. Okay.
Yep,
You know,
exactly.
Sarah knows my
You
mind
don't
is
use
simple.
it, if
so I
you
got
don't use it, you're off the hook. But if
Yes,
you want
exactly.
to use it, yeah, you're stuck.
Okay, just want to be clear on it. Thank
I would
you.
never call your mind simple, friend, ever. I appreciate you.
I know you always remind me of that, but I always go there. Okay. Learning every day.
Thank you. So any other questions? So good. This is really great that we're having, again, this is classic enhancement stuff, right? It's just like little things that have to be submitted. And the great thing is Gravity has a, not new anymore, but amazing team member, Susan Matney, who's not, I don't think Susan's on this call, but she is the queen of LOINC. So she's going to lead this submission for these new attributes within this LOINC document ontology. So lucky to have her. Okay, and again, if there's anything that you feel, this is a community exercise, right? So if there's anything social care entities, if you all review the ontology and you feel like there's a type that's missing, let us know, right? This is going to be a rolling enhancements initiative just to make sure that we have what we need, right? And again, types of documents, types of services, just want to make sure that we're sufficient. Okay, next slide. Fantastic. And I think I don't think there's probably any more questions. We did a good question and answer set. Okay, next slide. On to program enhancements, right? So we covered Coding for Food, which is terminology enhancements to food insecurity. We covered the LOINC document enhancements, which are enhancement, like conceptual and terminology enhancements to everything. And now we're going into our program enhancement section, all kinds of enhancements. Next slide. So there's 3 different areas we've been working on. I say this every single time. So one of them has been looking at all of our programs to make sure that we represent the programs that social care entities need for provision of services, or anybody needs. Like a huge enhancement initiative that we did over the course of this year was in partnership with the CDC, because we did not have sufficient levels of housing terminology to represent the granularity of housing concepts that they do in their program analysis and in case surveillance, right? So we had a partnership and we did a robust submission of missing housing program concepts, including like FHA loans, like everything you can possibly imagine that was like, again, stable, like federal program. So the first part that we're doing in enhancements is looking at the whole list of programs and making sure that we have what we need. That's a community project, and the lexicon of social care programs that we have in the Confluence is the way to find that. Work in progress, and things get added all the time when we have a SNOMED release or Coding for Food. And then there's the program classification, which we'll talk about today. We finally finished. Right, which is the amazing effort of developing an open consensus program classification of social care programs and other and non-gravity programs for the purpose of navigation and connection to services. This all hands on deck effort that grew out of the Health and Human Services data strategy. And then the last is developing standards for documenting service delivery and program enrollment. And that's a terminology and, well, all of the last two are terminology and technical working together, like as family. Because in program documentation, we are developing terminology to represent enrollment. And as they're working on the technical side and the IG for developing resources and use case to represent enrollment, right? So we work side by side and hand in hand. And so that's what's happening. That was like 2 meetings ago. I'm losing track. But know that the last element, terminology, is leaning into the terminology side, and the technical work stream is leaning into the technical side, and we collaborate consistently. Next slide. So program gap analysis, just noting that as part of our survey, beyond the CDC concepts the housing concepts that we found, that we presented in the last enhancement cycle, there's these gaps that we found in this cycle, and we're working on definitions for those. I have to get on that, Sarah B. I'm just like, every time I see a slide, I'm like, I gotta work on that. So more to come there. And again, some of these program gaps are coming out of our classification work, because we need to represent concepts that are critical within the classification. Next slide. And then now in program documentation, this is not entirely new. We presented this a couple weeks ago. Next slide. So again, I already said this, the goal of this is to ensure that we're representing the end goal, right? So if I refer to SNAP, the whole point is to get a person enrolled in SNAP, and we need some kind of standard for documenting that the person is enrolled in SNAP, receiving SNAP benefits, right? So we're working on representing the program concepts, certainly within our program classification work, but also working on representing core terminology for the most basic, consistent programs, not developing enrolled in concepts for everything. In fact, the VA just said, don't need to do that for us, right? But developing core concepts that are universal across the national ecosystem. Next slide. So we did a review. We did an initial enrolled in X program, like hypothesis, things that would be critical, again, across national implementations. And we took that stab. It's on the Confluence for review. And if everyone feels like that's okay after a short period of time, we're going to just submit those concepts to SNOMED. Again, not exhaustive. It's a minimal set of those core programs that are evidence-based and aligned with outcomes evaluation and are reasonably documented in persons' records over time, right? So not short-lived one-off programs. So looking forward to having you all review it with us. And again, it should be very familiar, like the basic programs funded through the Older Adults American Act or USDA initiatives or HUD initiatives through legislation. Next slide. And then we still have to figure out some of, and this is partly what we're thinking about again, and the idea is like what different statuses are important. And just, Corey and other members and implementers have been talking about the difference between being eligible for something, enrolled in something, and receiving something. Especially the biggest problem with that, and I mention this every time, is housing. Because in the housing ecosystem, you can be eligible for Section 8 housing choice vouchers. You can be enrolled in the housing choice voucher program. You can be on wait lists for years. Right, so maybe enrolled in this instance actually means receiving. We'll figure this out. There's some kind of intermediary state, but we just acknowledge what we know, and we've been doing this for six years now, that not all programs are the same, and the wait list for some programs are significant, and we don't want to confuse the ecosystem as we're building standards. The provision of stuff is easy. Next slide. Any questions on that part? That's just an update, again, asking everyone to look at that enrollment pick list and just make sure that it seems correct, or maybe it's too much and we should pare it down. But if folks can just review it over the course of the next weeks, that'd be lovely. It's available on the Confluence and linked in the chat. The last thing that we're talking about today is program classification. And I think Sarah, we're making sure I'm not missing things. Thank you. Okay. So the program classification is a year-long effort that we have been engaging in with our amazing friends and members within Gravity. We are almost to the point of, we really are like in our end-to-end review. We're going to spend the next couple of weeks sending it out. Next slide. I see one of our SMEs on the call. Hi, Nicole. I said this last time a couple weeks ago, but it has been an honor and a privilege to sit for, it's like 2 hours every week that we gather across 211 LA, Find Help, Epic, Unite Us, and 211 San Diego to work through the knitting together of all of the different classifications and taxonomies to create something that can be the Babelfish for each of them, right? So it's so much work. So grateful for their kindness, and we've become a merry band after a year, but it's just really just a Herculean level of work. And when it's done, it's worthy of a paper, Nicole. I think we need to publish our methods and get this out there because it really was a very unique effort that's, that's worthy of getting out into the ecosystem.
Definitely been a process.
Yes, it has been a process. It has been a process. And I think I'd love to have that, the methods that you've all developed and the expertise and the findings be disseminated if you all feel like that's helpful. The purpose of the classification was developing a classification for the purposes of navigation and connection to services. And we're working on next steps about how to represent those programs and the classification concepts next. But we did finish the classification and the end and the review of it. So next slide. This is just the model, and so I'm just going to say this in case anyone's on the call is new. The base of the classification is we start with a primary need, food, for example. And then we divided up programs into what about food you need help with. And then the primary work of the classification was developing the groupers. And the groupers are interesting because the groupers, there's 2 different types of groupers. There's groupers that are true groupers, right? It's a generic concept that is a bucket in which other concepts live. And this is really, again, to navigate you to all programs that do this. And then sometimes, because this is a navigation and connection to services initiative, and because it's classification and not a taxonomy, and in the beginning, we talked about this like a year ago. So things are in multiple places in this classification, and things are on the same level, even if they're different levels of granularity, if the subject matter experts felt like it would assist for the purposes of navigation and connection to services. So core common programs that everybody wants to find, like SNAP, for example, is at the level of a grouper because it's so important. The SMEs thought it needed to be at that level. So we're calling it a classification because of that. So if you look at the groupers at the classification, everything in bold is the final grouper concept. Sometimes that grouper is a program. And then underneath it, we've already done the work, and this is largely the work of 211 LA. Nicole, deep love for you. And Gravity, underneath the grouper, Gravity and 211 LA have put in all of our specific programs, right? So we've already done that work to show how specific programs that entities are involved in or enrolled in or connected to fit in under those groupers, right? And so that's incredibly helpful for implementation because then the implementers can start with the grouper and then go down to further in time to any level of granularity that seems appropriate, right? If implementers ask for further granularity, we've already built out those relationships either in Gravity concepts or in 211 LA concepts. So it's like, this is why it's a Herculean effort. Program type grouper is the primary effort again, but underneath 211 LA and Gravity have been knitting together all the different specific things people connect to. And then what I want to note again, because this is end-to-end review, if you're looking at the classification, population level attributes are not included in the grouper, right? So population level attributes are so variable that it's our next brief area of work is just get consensus on population attributes and how they could be applied to the program groupers, right? Like, but if you can imagine, you could do farmers market programs with an elderly population tag, and then you would get farmers market programs for elderly populations, right? So just noting that even though population concepts are part of every single navigation and classification system out there, they're not part of the groupers because they're a separate concept. I hope that made sense. I'm very sleepy. But you'll see it if you look at the classification. You'll see it even sooner when we get a brief, like a list of all the population attributes that we know are important. Next slide. Okay, this is again the same. I presented this slide 2 weeks ago. It again applies now because last time 2 weeks ago we finished all the domains. This time we finished our final review. We made quick work in 2 weeks. The Grover gift still applies. Amazing work, everybody. And now we are ready to disseminate. So this goes to the second, and you just look at the domains, it's vast. So food, transportation, housing, utilities, employment, material goods, social connection, engagement, physical health, mental health, substance use, legal help, financial assistance, direct care, technology access, safety and disaster services, and navigation in general, right? So, you know, those of you who are longtime Gravity friends, you know that Gravity did not address some of these concepts like substance use, but our members did, the subject matter experts did, and T11 has, right? So this is where Gravity was able to be just a facilitator to support, bye, Nicole, just to support the consensus finding on this critical topic, right? We've completed our final review and we're ready to disseminate it. We're going to go to the next slide. The classification final draft, Sarah B and I are going to work on it tomorrow just to make sure we apply all the edits and updates, and then we'll be available on the Confluence on Tuesday, and we'll send it out on Tuesday as well to those intentional reviewers. Next slide. And these are our first intentional reviewers. So the core intentional reviewers, meaning like people we are sending the classification to with a deadline for feedback as like homework, or every single one of the members of this me group are going to be doing that with their own communities. And then outside groups, we have the 211 EPIC Collaborative, which is a multi-state initiative that marries 211 functionality with EPIC functionality. So it's a very appropriate user. They're eager. They're right. They wrote me last week, ready to get it. And then we are also sending it out to the Community Action Agency Data Interoperability Work Group, who as community action agencies who are data interoperability focused are another perfect entity for intentional review. We are reaching out to our friends across the HHS ecosystem and SAMHSA, but it might take time to get them to have the bandwidth to be able to review given the current ecosystem. But know that we imagine the classification will have a very common update, a method akin to our value sets, where it's static for either 6 month or 12 month periods, and then the subject matter experts reconvene, analyze any comments and changes, and then apply them to the classification in a formal fashion. So even when we publish the classification, we imagine it will be an iterative and work in progress. So just but not an incredibly great effort, because we'll control the amount of change just as we do with value sets. But we're done, at least for this part. Gonna get feedback, gonna apply the feedback, and incredibly grateful to all the subject matter experts. Next slide. I think that's it. Next slide. Yay. Okay. Well done, friends. Coding for Food end-to-end review. Everyone needs to send us formal comments. It looks like Sandra's going to do that on the plastics wrap element. Please review the Lexicon of Human and Social Service Programs to see if there's programs that are missing. Review the draft enrolled in concepts and submit feedback. Review the classification tree master file and submit feedback. There's a lot of materials. There's 4 materials in enhancements and 3 domains over a new domain. So there's a lot of material for our community to review, but we cannot wait to get it. And we hope you all have a lovely Thursday evening for the rest of the evening. And I think that's it. Any other final questions? Besides, thanks for coming and bearing with me as I ran in from the interstate into my hotel. Thank you so much. Okay, next slide. I think we can close out. I'll see you all in 2 weeks for our, yes, you're so welcome, for our final end-to-end review meeting before we go into the consensus vote on the 29th. Thanks so much for coming, and we'll see you next time.
You, Sarah.